Well, good morning, everyone. How are you?
Good morning.
We have a very special guest today. Of course, you know Dr. Roger Moczygemba, but you might not know, and if you don't, it really is time for you to get to know David Balat. David Balat is the executive director of Free2Care. He's also the director of Right on Healthcare for the Texas Public Policy Foundation. Now, let me tell you how I met David Balat. That was within my work in the San Antonio Free Market Medical Association. And we all have one passion in common is figure out how we can solve the problem of giving access to affordable and good healthcare. And there's so many ways how one can tackle that, right? I do it from a marketing, PR perspective. Dr. Roger is the doctor who implements those new ways of delivering healthcare. And David Balat is very active, obviously, in policy. And what I find is very fascinating is that he actually manages to have a TikTok about such a complex topic. So definitely check that out. And I always say, when you are able to break a topic that is complex down into terms that people understand, that gets them thinking about how can we use that knowledge to drive change, that is very powerful. So without further ado, I will let the both of you take our virtual floor. You have lots to talk about. I know you have lots of projects, and I invite our audience to participate in the comments if that is desired.
Thank you,
Dr.
Shankar.
Roger and
Thank
David
you.
Balat.
Thank you. And David, thank you for joining me today with Shankar. You and I have been kind of in the trenches working on this for a couple years, 2 or 3 years at least. And so I'm so happy to have you on and hope you can mention what's coming up next week, what we have planned, and then also give your perspective of what we're trying to do from your standpoint. I mean, you trained and early in your career you were a hospital administrator. You ran a hospital, and so now you've made a switch in your career, and so just to kind of set the stage, we try to talk to employers in these short segments, and so if we can kind of frame what you're doing, what I'm doing, what we're doing together for employers, and maybe even talk about some next steps to help them realize the value of what we're doing. Great to have you.
Well, thank you for having me. And I really applaud this effort. Talking about employers, we can't wait on Washington. If we really want to change healthcare today, it's going to be the employers that do it. And it's just going to be a matter of implementing new and novel ideas that are unique. That might be a little bit scary because it's not the status quo. But if they do it and they do it incrementally, they're going to see a happier workforce. They're going to see a healthier bottom line. And we're going to see the healthcare industry overall change for the better.
That's right. And so that's what I've experienced over the last almost 4 years starting Direct Med Clinic, where we work with employers and provide this affordable care for their people, and they all love it once they experience it, and it's an example. And I think that's one thing that employers might be hesitant about with moving forward, like, where do I start, what do I do, how does this work? So I think that's why I like you being here talking about what we do, so you can provide this other perspective, and maybe there'll be an example for employers to see that on a larger scale next week at the conference.
Yeah. Well, let me just talk about the conference very quickly. Free2Care is a coalition that I started 3.5 years ago, and it has really just taken off. We have 34 member organizations representing over 8 million people nationally, and that includes over 70,000 physicians. So it's been a lot easier to get access to politicians at both the state and federal level, and have them get a seat at the table. Essentially, I hear from doctors all the time, the AMA does not represent physicians; they represent the AMA. So it's important that the voice of the physician in tandem with the patient is heard, so that the people who are influencing policy can make those decisions. Well, so that's the coalition, and we have our annual conference coming up next week on the 15th and the 16th, and we've got some great speakers. We've got, we're nonpartisan. We try to stay away from politics because one of the things that we always say is healthcare is personal, not partisan. And so, but we have people from both sides of the aisle. We have a Biden appointee, the drug czar, the first medical doctor that role by our president. We have the North Carolina treasurer who's on the other side of the aisle. And what's wonderful about that is that when we frame it through the lens of how we want to discuss healthcare, we tend to agree more than we disagree.
Mm-hmm. Wow, that's a great insight.
So yes, so we're excited about that. Day one will be more federal in nature, and then day two will be focused on a new trade association dedicated to the state of Texas. It'll be the launch of that organization called Direct Care Texas, which Dr. Roger, you're a big part of. And we want to show that it's not just direct primary care anymore. Direct primary care has gotten to be more into the mainstream now, and that's a wonderful thing. But most people will say, well, what about a specialist? What about a CAT scan? What about surgery? What about some of these other bigger ticket items? Well, they exist. The direct care option for those organizations is coming into a reality, and boy, is it surging. And so we've created an organization where they can have a voice in the state to say, look at us, look at what we're doing, and to see how we can help you.
Absolutely. And not just a voice, but a community where employers can form a community with direct care providers, not just direct primary care providers, but specialists are also invited to the conference because they're part of that care continuum. So very exciting stuff happening.
Well, the panel you'll be moderating, Roger, is probably one of the most exciting ones that we'll have. It's going to be the employer panel. We will have Dr. Kristen Dickerson, who is CEO of Green Imaging. She works a great deal with employers. And then we're going to have actually a state representative, but he's going to be there not only as the chairman of human services in the state of Texas, he's going to be there as a large employer in North Texas. So he's going to talk about the changes that he's making for his own employees. And then thirdly, we have an HR expert, the HR executive for a large company based here near Austin.
So we'll have a continuum on this panel for the whole approach to how to get this kind of value in your organization. So I hope that employers are listening, that they can make it up there if at all possible.
Yeah, you mentioned employers. Is that who is the perfect attendee in your mind for that conference, David?
I think it's important, as I said in the very beginning, the real change agents for changing healthcare in this country are going to be the employers, the decision makers for those organizations. So I think it's important for them to be there, but I wouldn't say that it's just one category of person that's the most important. We like to have patients, we like to have physicians, and we're offering a CME credit for physicians. So I think it's important for everybody to come because this is new information for so many people. You mentioned my TikTok, and one of the biggest challenges to having that kind of platform is that I thought I would to say what I needed to say. It's actually the attention span is more like 20 to 30 seconds, and it's very challenging. But that's how we have to fashion our message. There won't be that at the conference, but it's good for everybody to hear these things and hear them repeated and be able to understand it to the degree where they can share it in an elevator pitch to someone who may be asking them.
Mm-hmm. Great.
So if It's very interesting that you mention that employer that has a large number of employees. And what do you typically see? Because having observed that a little bit as a marketer, I see there's a certain aspect to understand as an individual patient, and then you have your small businesses, let's say less than 12 employees, where the CEO makes the decision, and then you have everything between 10 and 200 employees, and then more. Like, this is a question to the both of you. When it gets into these higher numbers of employees, what problems need to be solved, and what kind of team does one might have to consider to tackle these issues?
Roger, you want to take that first?
Yeah. So one of the biggest problems I like to work on with an employer, large or small, is access. One of the first things we do is try to, with a small employer, we'll give them access to us with a HIPAA compliant secure app. They can text us. We'll get them in same day or next day. With a larger employer, then who has a benefit consultant, we'll try to work with them to design a plan that focuses the patient or gives them access to the DPC doctor. Okay, so we can manage that care to prevent downstream cost of going to the urgent care, emergency room, hospital, that kind of thing.
And I think in addition to that, when you talk about access, especially for the larger employers, you're talking about having a more transparent fee-based pharmacy benefit manager, the PBMs, where you get access to your medications, having a hospital network that is willing to work on a schedule or a fee schedule that's based on a multiple of Medicare as opposed to a percentage of their billed charges. Working with, and let me take a step back. It really comes down to understanding your client or your patient base, your employee base. Some organizations are you're looking at folks in the average age and your employees is late 20s, say 29, or if it's say the early 50s, that's a different set of healthcare needs. So I think your network and your thinking in terms of access needs to change based on your employees. Now, that being said, employers are not in the business of healthcare. You want to offer health insurance. You want to offer some kind of product that is attractive so that you can recruit and retain your staff. You also want to make sure that they're healthy enough so they can continue working and not be off for prolonged periods of time. Because that's not your business, that's not something that you readily know much about. That's where guys like Dr. Roger come into play. They are the advocate for the organization. They're the advocate for the employee. They're this form of reimbursement is so different from the way it is traditionally, because it's one of the few models that incentivizes medical professionals like him to make sure people are kept healthy and that they're having the best quality of life that they possibly can. So those are things to think about, and that's how you should approach the bigger employers, is really think about who your employees are, what are their ages, what are their issues, what is their history. Work with the medical professionals so that they can manage that as best as they can.
Yeah, I like that, and I have to ask you, David, because you are an expert in policy. The CAA, the so-called Consolidated Appropriations Act, is that a step in the right directions to kind of set a framework where employers and the anti-ACA system kind of are highly incentivized to go into the right direction?
Well, I haven't seen all of the language, but I always get a little bit nervous when government introduces new bills and laws, because they don't always get it right, as we've seen historically. The unintended consequences sometimes are more disastrous than the situation we were in the first place. So, I think the repeal of more laws is probably more necessary than the addition of new ones. We have a lot of things that could be fixed, and those are things that we need to focus on as well. But where policy and politicians and the advent of new laws really has meaning is when they are following in the wake of what the business community is doing, not the other way around.
I agree.
Employers shouldn't be led by a leash by Washington or Austin or whatever state you're in. The private sector should be taking the lead and embarking upon new models. Being brave enough to try some things that haven't been tried before, that have been tried before, that aren't as prevalent, is going to be important, because you can take that success. And I know, Roger, you've have some case studies that have been able to demonstrate significant success. Take that information to your lawmakers, to your representatives, to your senators, both the state and the federal level, would be eye-opening to them, because I can tell you that they don't think that what we're talking about today or what you've talked about in your past podcast, they don't think it's scalable. They don't think it's real. They don't think it's this, that, or the other. But hearing from enough people will start to make a difference in their mindset.
Right. And I would just like to add to that and saying that the best change will start from the ground up, not from the top down, showing the value that is generated between doctor and patient, or company and clinic.
Yeah, absolutely.
Well, it sounds like you will have a great lineup and a great conference there in, let's give us a little bit more information about when and where and how. I think that's really important for people who want to attend.
We'll be downtown Austin, both the 15th and the 16th, both full days. First day lineup of speakers, we have, if you're a football fan, Junior Bryant from the San Francisco 49ers will talk about his struggles with the healthcare system after having a traumatic brain injury. Bob Berkowitz is a global media and communications trainer. Dr. Darren Akuta, who's a neuroimmunologist from UT Southwestern, will talk about drug waste. We've got Dale Folwell, as I mentioned, and then Dr. Rahul Gupta from the Biden administration. So we've got a packed day. And even in that evening, we have we'll be premiering a documentary called America's Healthcare Crisis that our coalition is heavily featured in. So we're excited about watching that and seeing that and getting a chance to look at it before the rest of the world does. And then the next day, we're gonna again launch Direct Care Texas, and we're gonna have many physicians from Texas that are utilizing a third-party free model. They're going direct, and you've got radiologists, cardiologists, primary care, of course. You've got rheumatology. You've got a lot of different specialties that many considered you couldn't go to without having an insurance card. Well, these folks, these very brave individuals, are proving otherwise, and I'm excited about sharing their message.
Yes.
What's the best way to get a ticket if I want to attend?
You can go to our website, which is Free2Care. It's scrolling there at the bottom. You can go to eventbrite.com and type in Free2Care, just like that right there, and it should bring up the September 15th and 16th event there in 2022. We've had some in the past, so don't go to that one. You're able to get a ticket there.
Excellent. Thank you so much, David, for joining us today.
Oh, it's my pleasure. And for those of you watching today on LinkedIn and you'd like to get a ticket, I'd be happy to extend the discount code that will give 30% off. It's Partners 2022, PARTNERS 2022, and that would give 30% off the ticket if you choose to attend. And we look forward to having anybody who'd like to attend.
Excellent. Thank you so much.
Amazing. Well, thank you to the both of you for taking time. And I will tell our live viewers there's always the option to, of course, connect with David and Dr. Roger. And there's also the option to leave questions in the comment section. We will get back to those. For now, have a wonderful rest of the day, and I hope we will see some of you in Austin there.
Excellent. Thank you. Have a great day. Thank you, David.
Thank you, gentlemen.